Hey Ryan, how are you doing today?
Pretty good.
My name is Gary. I'm your student physical therapist today, and we're just going to be doing some palpations on your feet, if that's okay. All right. So we'll start by palpating the Achilles tendon, which is on the posterior aspect of the ankle, and it's going to be attached distally to the calcaneus, and it's this big cord-like structure in the back. So it's right over here, and then moving on to the deltoid ligament, it's going to be on the medial aspect of the foot, and it's going to present itself more when I have the patient plantar flex and evert their foot. So go ahead and point down and point your foot out towards me, and it's going to be this thick fibrous structure that's on the medial malleolus. So right over here. And then moving on to the cuboid bone, it's going to be on the lateral aspect, and it's going to be distal to the calcaneus and proximal to the fifth metatarsal, and it's going to be a cube-shaped bone. That's right over here. Okay, and then all of these palpations are going to be done with the patient seated and with the therapist seated on the testing side. All right, thank you, Ryan. All right, Ryan, we're going to be moving on to goniometric measurements of the ankle, and we'll start with transverse tarsal inversion of the ankle. And gonna go ahead and have you relax. Your patient's gonna be supine, and they can be seated as well. We'll start with placing the axillary rotation in between the two malleoli at the anterior ankle, and then the stationary arm's gonna be midline of the lower leg going towards the tibial tuberosity, and the moving arm is going to be at the medial aspect of the second metatarsal. And I'm going to go ahead, have the patient relax, and then move their foot into inversion, which is kind of moving it towards me and towards the patient's midline. And normal for this is going to be 40 degrees. And Ryan is at 37, which is below the normal of 40. And then moving on to the next one, it's going to be ankle dorsiflexion. So I'm going to go ahead and have the patient switch to prone. And with this, I'm going to make sure to find the subtalar neutral. And I'm going to position the axis of rotation at the lateral malleolus, and the distal arm, or the moving arm, is going to be pointed towards the fifth metatarsal, and the stationary arm is going to be at the lateral aspect of the leg on the fibula, or the lateral aspect of the fibula. I'm going to find the subtalar neutral, and then maintaining subtalar neutral, I'm going to push the patient's foot towards their shin, or pushing it into dorsiflexion, and normal for this is going to be 20. So I'm starting at 90, and Ryan ended up at 80, or at 72, so that's 18 degrees of ankle dorsiflexion, which is below the normal. All right, Ryan, we're going to be moving on to some manual muscle testing at the ankle joint. And we'll start with testing the weakness of the tibialis posterior. So I'm going to go ahead and make sure that the patient is supine for this one. I'm going to have them laterally rotate their leg and support their leg right above the ankle. And with this one, I'm going to be moving the patient into dorsiflexion and eversion. And first, I will start with 2 fingers. That's good. Progress to moderate resistance. Good. And then progressing to grade 5. Good. All right. And then, so that's a grade 5. And then we'll move on to testing weakness of the flexor digitorum longus. Patient can be seated or they can be supine. I'm just going to keep them in supine. I'm going to make sure that their ankle is neutral. And then make sure I'm going to be placing my hand at the distal phalanges of toes 2 to 5, and I'm going to be forcing the patient into extension, and they're resisting. So first, I'm going to apply moderate force, that's a 4. 4, good. And then I'm gonna go ahead and apply greater force. And he holds his isometric contraction, so that's a great 5. All right, Ryan, we're gonna be moving on to some special tests of the ankle, and we'll start with the anterior door test of the ankle. The patient's gonna be supine or they can be seated. And I'm gonna go ahead and have you flex your knee and relax your gastroc and your soleus. And I'm gonna position my hand and support their distal leg and have one hand behind their heel and place them into 10 to 15 degrees of plantar flexion. And from here, I'm gonna pull their heel towards myself anteriorly. And it doesn't move out of the Mortise box. So that means that the integrity of the anterior tibiofibular ligament is fine. And next, we'll move on to the windlass test. So patient's gonna be supine for this one. I'm gonna have them in slight dorsiflexion and then extend their toe. And there is a prominence here, so that means that there's no rupture of the plantar fascia. And then, is there any pain with that? No. That means that he does not have plantar fasciitis. All right, thank you, Ryan.